For the first time in nearly 20 years, the CDC has loosened guidelines for speech milestones expected in young children. Critics worry the new guidelines will cause more delays for children to get early help when they need it most. Team 12's Joe Dana spoke with an expert at ASU about what parents should know.
At 12 News, we've received feedback from speech and language experts worried about how these new CDC guidelines will impact children. Specifically, they worry more kids will enter preschool and kindergarten with speech delays that have not been addressed after the brain has already undergone a crucial stage of development. Developmental milestones are clues for parents to know whether your child is progressing in speech and language at what might be considered normal. Last month, the CDC and American Academy of Pediatrics announced the checklist for pediatricians has been revised. Some changes appear proactive, like identifying social milestones, such as when an infant should start smiling on their own, and 2 additional checklists at 15 and 30 months. But one big change has some speech and language specialists concerned. A child's ability to say at least 50 words went from 2 years to 2.5 years.
What it's doing is it's moving the needle.
Nancy Scherer is a professor in speech and hearing science at ASU.
The concern, I think, is that by changing these milestones, parents are not going to be as aggressive about following up on concerns they might have.
The new guidance conflicts with the American Speech, Language, and Hearing Association. It states a child saying fewer than 50 words at 2 years old is a sign of a language problem. The CDC, however, says all of the changes combined are the result of several years of study and are meant to provide more specific guidance for doctors and parents at even earlier ages than prior guidance. Still, some preschool and kindergarten speech and language pathologists worry there will be a greater influx of students entering school behind in speech skills.
Certainly, if kids don't get early intervention, they're more likely to have academic issues that are going to arise later on.
Adding to the concerns of schools, there is some research showing children born during the pandemic may have delayed social skills.
Whether that's long-standing or whether it's going to be short-term, we just don't know.
Scherer's advice to parents is to be proactive with your pediatrician, ask questions, and do your research on interventions available if you have concerns.
There are a number of resources for parents if they have concerns.
We have links to those resources in our story on 12news.com. Joe Dana, 12 News.
Joe, thank you.